Hey, this is Doug Field, the CEO of the Institute for Healthcare Consumers, along with my co-host, Brent Macy, Managing Director, and welcome back to Healthcare Consumerism Radio. We're pleased to have joining us on this program today, really one of the leaders in the engagement space, and Doug Ghertner, President and CEO of Change Healthcare out in Nashville. Doug, good morning.
Good morning. Thanks for having me.
Yeah, nice to have you here, Doug. Give our audience, before we start, kind of a backgrounder on Change Healthcare, if you would.
Sure, probably just take a minute to do it. So Change Healthcare started in 2007, has been around here, I guess, nearly 7 years. And our focus really is on working with large self-insured employers and health plans to help their employees and members make better purchasing decisions. We do that across a number of different dimensions. Cost transparency is certainly one of them. Benefit education is another. And then what we'll talk a little bit about today are some of the work that we've done to complement many of their care management and wellness initiatives.
Yeah, you start out with a question here about, employers and why should really employers care where their employees go for healthcare services? I mean, why should they care?
Well, at the end of the day, they certainly are footing a lot of the bill.
Yep.
So from a financial perspective, they clearly have a vested interest. I think the other piece, though, is they really do have an opportunity to influence how their employees go about obtaining high-quality, lower-cost care. And I think it's the ability to provide certain tools to help them make better decisions that really factors into why that employer should care. I think the other thing I would say is that 70+% of employers do offer some type of condition management program, wellness program, et cetera. And so as they make investments in these programs, it really does become important that they get their employees to take advantage of the investments that they're making.
Yeah, so it's both the the healthcare cost for both the consumer, employee, consumer, and the employer bearing some of that cost, and it's the health and productivity issue around the health of that employee and their families.
Absolutely.
Yeah.
Now, Doug, when you look at some of your data, how do you gather your data to aggregate it to help that employer and that employee population in some of these decisions?
Sure. So as part of our core transparency platform, we're bringing in a whole host of claims data, medical, dental, pharmacy, vision, eligibility information, provider quality information. And so we have that data already today. As we've rolled out this new product, Targeted Engagement Alerts, which are really designed to complement a lot of those wellness and preventative care initiatives, we're leveraging that same data set. And really it allows us to reach out and support many of the other initiatives that a client might have. So as an example, they may want us to target all women over the age of 40 for a mammogram. And so what we're able to do is use that claims data, look back and see, okay, who are the women who are over the age of 40? Who are the ones that haven't received a mammogram in the last 12 months? And then how can we direct a very pointed message to them, educating them on the importance of the mammogram, and then also showing them here are the 4 or 5 providers that you can go to. Here's what it'll cost. Here are the quality ratings of those providers, et cetera.
Doug, you did a very unique pilot with Cerner. Is this some of the takeaways from Cerner, and if not, what were some of the experiences at Cerner? How did they use the tool, and what were some of the results?
Sure. So Cerner is an employer client of ours. Their focus, as opposed to just around preventive and wellness initiatives, was on point-of-care optimization, specifically in the context of on-site clinics and pharmacies that they had invested in. And so what we did is, again, look through their claims data, identified all of those individuals who were purchasing care in the community that could have been delivered at one of their on-site clinics or pharmacies. With that information, we sent out a proactive alert targeted to each of those individuals, highlighting the benefits of moving their care to that on-site clinic or pharmacy. And what we saw were fantastic results. Across both of those two settings, over 90+% of the people who received an alert from us actually moved their care. I think what was more interesting to us, however, was the fact that 31% of the people that went to the pharmacy and 22% of the people who moved their care to the on-site clinic were first-time users. Now, these are clinics and pharmacies that had been there for 5 or 6 years and that the employees oftentimes walked past on a daily basis. But it really highlighted for us the importance, especially for that employer. If they're going to make investments in additional benefits and programs for their employees, they've really got to make sure they do a great job of promoting those investments that they've made so that they can get the employees to take advantage of them.
Yeah, Doug, along that point, and we hear the word all the time, engagement, and it's a big word out there. Talk a little bit more about the reason these employers need to get their employee population more engaged in their health.
Yeah, so it is, first of all, I would tell you that, I can't remember the survey who did it, but 57% of employers said that employee engagement was their single biggest issue that they're trying to tackle as they think about their investments in healthcare. And, one of the things that we've seen is there are a whole host of different tools and resources that are made available to employees. And I think each of those employers makes those for two reasons. One, they do want to improve the health of their employee base. But two, they do want to lower their healthcare costs. And I think one of the things that they're oftentimes finding is that despite making those investments, they're not getting the uptake, the engagement from their employee base. I think one of the other things that we've learned is that financial dimension is actually a very relevant one on which to build a relationship. And I think that was the jumping off point, frankly, for us to create these targeted engagement alerts. We built, as part of our transparency tool, a set of claims-driven, preference-driven alerts whereby we look at an individual's utilization of common and recurring services and we shop on their behalf. And what we saw is that when we sent those alerts, nearly 60% of the people who received them opened them up, logged in, and did something with them. And so recognizing that, we saw that as a great way to create better engagement in some of the non-financially oriented initiatives that our clients have underway. And again, for them, it's really all about maximizing the value of that healthcare investment that they're making.
Yeah, Doug, when you talk about some of the existing programs that an employer has, I mean, you alluded to this getting people to utilize the on-site clinic more and the pharmacy in a different way. I'm assuming that your targeted engagement alerts can work in conjunction with other wellness and preventive care initiatives that an employer has in place.
Absolutely, and that's really one of our core philosophies, which is, look, let's figure out how we complement as opposed to compete with our employer clients or health plan clients' initiatives. Again, 70+% of them have other programs and other vendors. It doesn't do us any good, and it certainly doesn't do them any good if we're all stepping on one another's toes. And so for us, it's about leverage that relationship we were able to build on the financial dimension to drive better engagement in the other programs and investments that they're making. We have certain clients who have invested in telehealth or telemedicine programs.
Makes sense.
And so now one of the things that we'll do is we'll actually promote those types of programs within our tool.
We
have other clients who've invested in HSA accounts for their employees as part of a high deductible plan offering. And so for us, it's about that integration and that cross-promotion between us and the HSA administrators so that we can make sure as employees make their decisions, they're making them in as informed way as possible.
So do you talk about HSAs? I mean, there's a lot of activity among the HSA players to really create that portal. I mean, would you see yourself fitting within an HSA portal in the future?
Well, we actually do it today. So interestingly enough, we've got one large employer client up in the Northeast, and they work with one of the leading HSA administrators. And, as part of that integration, we do two things. One, we pull in an employee's HSA balance into our portal. So as they go and they look to shop for care, they respond to our alerts, they can see what their HSA balance is. But conversely, the other thing that we've done is we've taken a set of APIs and we've integrated our savings alerts into that HSA administrator's portal.
Wow.
So that irrespective of where that employee chooses to go and obtain their information, they're going to learn about the savings opportunities that they have available to them. And so that bidirectional integration we think is really important. And again, it's about creating this surround sound experience for the employees so that you are able to deliver relevant information to them in the medium or in the location that's most comfortable for them.
Very interesting, Doug. So let's talk about some of your current customers or health plans, and health plans are trying to own that portal too. This is a natural fit with them, is it not?
It is, and we're a bit unique in the space in that, certainly for many of our employer direct clients, we will host that user experience ourselves. But for our health plans, as you can appreciate, they've spent tens of millions of dollars building their brand and building their member portal, and oftentimes the last thing they want to do is create another destination for their members. And so we have built a set of APIs that allow us to integrate all of our functionality, be it our cost lookup tools, our targeted engagement alerts, our ways to save alerts, into their portals, and so that information can still be obtained and consumed by the member, but it's consumed in the context of a broader health plan member portal.
Hey, Doug, we've got about a minute and a half to go, and I want to give you an opportunity to kind of wrap this and leave our audience with some takeaways. I really appreciate your time today. So leave our audience with a couple takeaways and how they can find you guys as well.
Yeah, so I would say first and foremost, investing in tools is one thing, but you've got to invest in the effort to promote those tools and make sure that you get your employees or your members to use them. From our perspective, you can have the best cost transparency tool. It can have all the bells and whistles, but if people don't use it, it's not going to drive any value. And so with that in mind, we think taking a very proactive, highly personalized approach is absolutely critical if you want to drive value. I think the second thing is recognizing that as you work with employers or health plans, there are a whole host of vendors out there. And I think best practice would suggest you get those vendors to work together. You look for opportunities to integrate, and you certainly look for opportunities to cross-promote. As far as reaching out to us, certainly happy to engage with anyone. We've got our website. There's a lot of great information out there. It's www.changehealthcare.com, and certainly appreciate the time today, guys.
Hey, you're welcome, Doug. Thank you so much for joining us on the program. And I had one last question. The connection with the exchanges as well. You got the connection point there, too, correct?
Absolutely.
Okay. So
what I would tell you is, when you look at this first run of enrollees in the public exchanges, 8 million people, you saw 60% of them enroll in silver medal plans. You saw 25% enroll in bronze medal plans. The average deductibles there are $3,000 and $5,000. So the consumer is really bearing a significant portion of the cost.
And the private exchanges as well? The private exchanges too?
Private exchanges, you are seeing a high prevalence of high deductible plans, not necessarily at that level that broadly. But what I would tell you is in that individual market, these types of consumer-friendly tools become increasingly more important as you do push financial responsibility to the consumer.
All right, Doug. Hey, thank you so much for joining us on the program today. Have a great weekend up there in Nashville. Would love to have you back. And to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.
Thanks, guys.